Hello, Dr. Greg again with part 6 of sugar. So today I want to talk about just a couple things. This won't be a very long video, but I want to talk about what we call HB1AC, and then I want to talk about insulin resistance. Now, let's look at this. HbA1c is what they use to calculate your average blood sugar level over 3 months. And the reason they use 3 months is that's how typically long a red blood cell lives. So it measures how much sugar is carried by your hemoglobin for 3 months. It's an important number because it tells you a lot about the condition of the individual, and the value they give is a percentage value, okay? And the percentage value is between 4 to 5.5 HbA1c. It needs to be between 4 and 5.5%. That's all you need to know. And then they calculate your average glucose levels from that. And it's a calculation, just plugging in some numbers and you get an average. Now, again, the best number is between 4 and 5.5. When it gets to 6 or above, then you're classified as a diabetic or pre-diabetic. So it's important to know this number. So if you're fasting blood glucose levels, your doc should go with what's called HbA1ac. That is an important number to find because if it's in the 5s, you're on the higher end of trouble and you need to take care of that through dietary changes. You don't want to ignore it. Once you're on insulin, there's really no going back. Now this leads into what we call insulin resistance. And I think I've mentioned insulin resistance a few times. It's usually the result of too much sugar intake. And what happens is that your cells no longer accept insulin as a mediator between getting glucose into it. So your blood sugar levels are a lot higher, which can actually cause some damage to the vascular system. Now, plaquing and things like that occur because the blood sugar in your blood vessels are damaging the blood walls, which actually makes cholesterol have to fix those walls and you build up plaque. Now, how do you know you have insulin resistance? Well, there's a few ways of knowing. One, if you are not getting blood work right away and you haven't seen your doctor, if your waist is 40 inches, over 40 inches waist, and in women over 35 inches in the waist, it's more likely that you will have insulin resistance. Now, blood pressure readings above 130 over 80 or higher can also suggest insulin resistance. Now, this is where we get into, there's also something called skin tags. That can also indicate that you have insulin resistance. Now let's get into the blood work. What numbers, blood work numbers, would indicate you might have insulin resistance? Well, for HbA1c, it needs to be, if you're over 5.5 or 6, chances are you have insulin resistance. If your fasting glucose level, blood glucose level, fasting, in other words, you haven't eaten for 12 hours, if it is over 100, if the number is over 100, you probably have insulin resistance. Now, coupled with that is a fasting triglyceride, and this is usually done when you have your lipid panel. Triglycerides over 150, and I would actually argue over 100, also suggests insulin resistance. Now, cholesterol is divided into 2 parts. You have the HDL, which is the high-density lipoprotein, and the LDL, which is low-density lipoprotein. When the HDL in men is under 40, there's a good chance they have insulin resistance. For women, under 50. So those are the blood markers we look at to see if you have insulin resistance. Now, how do you deal with insulin resistance? Well, there's a diet. You have to obviously stop eating sugar, but there are ways to help your system work better so that you don't really necessarily have to be on medication for insulin resistance. 80% of health according to the CDC, is lifestyle. Lifestyle impacts 80% of our health. So if you can get your lifestyle under control that actually fits a healthy lifestyle, you can resolve 80% of the health problems we have in this country. So that's what I have for today. We're going to start getting into how sugar affects the brain, the pancreas, the lungs, all that kind of stuff leading up. So this was Sugar 6, and this is Dr. Greg, changing the way we look at health.